Oh.
Okay, let me be serious. I can't be too. Okay, I need to look like a doctor.
Okay. Do you need a stethoscope?
Tina, please.
Okay. Alright guys, welcome back to another video. If you're new here, please subscribe. Remember my hair. Hello guys, welcome back to another video. If you're new here, please subscribe, hit the notification bell so you're notified every time I post a video. And if you're a returning subscriber here, you're most welcome back, and thank you so much for supporting this channel. Well, I am Tina Tuli, a 4th year medical student at Pirogov University, and today with me is
Emmanuel, a 6th year medical student at Pirogov University.
Yes, Emmanuel is a final year medical student. And today we're talking about a very interesting topic, the woman with the issue of blood. Well, the book of Luke chapter 8 verse 43 talks about a woman that had a severe bleeding for 12 years, that purposed in her heart that if she touches the hem of of Jesus' garment, she'd actually get healed. And yes, we just want to look at it from a medical perspective. As medical students, if she came to us, what diagnosis would we give her? Would we actually help her? Would we treat her? And that's what we're looking at today. And Emmanuel will take us to the introduction of the topic.
Okay, first of all, I really just want to say I'm really excited and I'm really honored to be on this channel, because like looking at the medical conditions in the Bible and seeing them through the scope of medicine in our time and age is actually an amazing idea, and I'm really honored to be a part of it. And so going to the topic of today, the woman with the issue of blood, like I feel we all know that lady, and it's just amazing looking at her. Like, what would be her symptoms? What's the cause? What's the reason? You know, in traditional times and in the olden days, we see blood and we think witch, but like us as medical students right now, what can we say about this? How are we going to look at it? So the woman with the issue of blood. So seeing her from a medical point of view, we have all written case histories, and looking at her, first thing we have to talk about is like the anamnesis, like where did it all start from? How did it all come about? And we see that the only information that the Bible actually gives us is that she had it for 12 years. And she has always been known to have this disease. So technically it started from when she first had her first menstruation, right? I mean, logically speaking, we can't be so sure, but like if they have always known her to have the issue of blood, it should have started early enough. So imputing that data into our brains, it looks like, I would say she was in her early or late 20s, actually. And
25.
Yeah, 25.
There.
And
that's if she started menstruating at 13.
Of course.
Or maybe 14.
Even if she had late menstruation at the age of 19 or something. But and it already puts it into perspective. She was actually one of us, you know. Like, I mean, I'm not that old, you know, so and that's already really, really interesting for me. And then if we're looking at, still going by our patient history, we would look at her symptoms. So what symptoms did she have? First of all, we can see she had bleeding, right? And in putting it through our knowledge of internal disease, we can say that she had anemia. I mean, anemia is something that comes with with most chronic diseases, and if this is her like for 12 years having the issue of blood, definitely she's going to have anemia. She's going to have some iron deficiency. I mean, makes sense, right, guys? Medical students. She's going to have some iron deficiency, and you know the symptoms that come with iron deficiency, because iron is a very important cofactor where we come to cells. So that's why we see that there's going to be some scaling of her skin. You know, even when we're looking at mouth, we're going to see some changes because of like the chronic level of her anemia. So I'm like attributing these factors to her. And we also know that for anemia we could also have like loss of weight. You know. And so I'm seeing her as a scaly, really slim lady that she's also going to have weakness, right? So, but how do you think she what do you think about her psychological state?
Definitely too bad, because according to the book of Leviticus chapter 15, there they say that as long as a woman was menstruating, she was considered unclean for the number of days that she menstruated. Imagine menstruating for 12 years, meaning you are unclean for all that number of days. And of course, people coming to you was not something that is very open. People not easily just come to you like that. And therefore, that would have also attributed to her psychological issues.
Yeah.
Yeah.
So we can see her, like, it wasn't just the issue of blood. There were like the somatic signs, like the somatic symptoms, and she also had psychological symptoms too, and it was crazy, you know. And just imagine her, a lady that should be at her prime and making the best of her life, making the best of her early years, is tortured by this disease.
Yeah. And when we talk about the blood flow, how much was it? How could we measure?
So first off, when a woman has a heavy menstruation or a heavy flow of blood, it's called Menorrhagia. So that's what we're going to be calling it at this moment. And basically, for every woman, because we want this video to be informative for everyone out there. And how do you know you have Menorrhagia? That's like, so the easiest way is if you have to change your tampons every hour. So that would already be a sign that, is everything okay?
Yeah.
You know, or let's say on an average you would use 3 tampons in a day, and then I don't know.
Who uses tampons?
I don't know.
Okay, for those that don't use tampons, pads. I mean, just pads.
I was trying to be a doctor here. Well, but the point I was trying to make was that your normal amount of pads or tampons would double. So let's say yours, your own case didn't like start from when you were very little. Maybe something happened, and then suddenly you started noticing that the amount of pads you started buying doubled. So you gotta check yourself out.
Yeah.
So yeah.
And yes, just to take us to the causes, what do you think really caused this menorrhagia? The fact that she was bleeding chronically for 12 years. What possible causes would you be looking at? Yeah, much as we've seen at her anamnesis, we've seen the family history, we've seen what possible things that, I mean, her lifestyle personally, yeah, definitely. But what do you think actually caused this menorrhagia?
Okay, so in general, menorrhagia has like various causes. Some of them chronic and some of them not chronic, like acute, and then we're just going to go into them according to the different systems in the body. I think it's going to be more understandable that way. So if we're going to go to the endocrine system, we can say that a hormonal imbalance can cause menorrhagia when a lady has a high level of estrogen and a lower level of progesterone. So because of that, the endometrium grows more than it's supposed to, and then when it's shedding, because you know menstruation is shedding of the endometrium, and then if it's increased, then there's going to be more shedding, and that can cause heavy bleeding. So that's all I'm going to give you for the endocrine system. And then if we go into the female reproductive system, the uterus, if a woman has uterine polyps or fibroids, you know, the difference between both of them is basically the cells that they are made up of. So polyps are made up of basically the endometrium, and then fibroids are made up of muscle cells. And then you can also have, like, if there's an ectopic pregnancy. So if like the baby was making his way to the uterus, and he was like, let me stop at the fallopian tube and, you know, chill over here. So if he does that, you know, or he goes to the abdomen, that could also cause like bleeding, continuous bleeding, because the baby is not developing there, or he could actually cause a tear in the fallopian tube, and then that could lead to bleeding. And then there's also adenomyosis, which is when the endometrium enters into the myometrium, which is the muscle layer of the uterus, and then keeps growing. So because of that, it like causes heavy bleeding, because you know the endometrium stays in the myometrium for a longer time than it's supposed to. And also one of the interesting ones I like, so leaving the female reproductive system, we can go to caused by the drugs we take. So aspirin, which is an antiaggregant, can actually cause heavy bleeding. You know, you say, oh, I have a headache, take aspirin. And you might be taking aspirin for a very long time, and you might be having heavy bleeding, and you're like, you don't make the connection. That could actually be a reason. And then also looking into caused by medical practices, you can also have intrauterine contraceptives. You know, you could place an IUC into your uterus, and it being there, not being placed very well, it could actually cause heavy bleeding. So yeah. Oh, and oh my god, how could I forget?
The most important.
When you have a hematological disease, like basically with a problem with your coagulation factors. So this is where I would hand it over to Dr. Tina.
All right. So the woman with the issue of blood, her condition is usually associated with van Willebrand factor. And when you have a deficiency of this van Willebrand factor, it means that there's going to be an issue with factor 8, which Emmanuel will speak about. Now, van Willebrand deficiency is an autosomal dominant disease that is usually inherited from childhood or from birth. And therefore, if this lady actually had this issue, it means that factor 8 was going to be an issue. So van Willebrand factor is actually produced by the Weber palette bodies of the endothelial cells and also the alpha granules of platelets. Now, what happens to it, whenever you have an injury, it's actually produced from the endothelial cells and the platelets. So it's produced on the surface, and it usually attaches to the subendothelial collagen. Attaching to the subendothelial collagen means that it's viable. I mean, it's visible for the platelets to actually attach on it, and with that, blood clot formation is facilitated. And Emmanuel would speak about the coagulation cascade and how to actually treat this van Willebrand deficiency.
Okay. So the coagulation cascade. Okay, so we're going to be talking about the coagulation cascade, and I know every medical student remembers this from physiology, and I'm just going to explain it in the best way possible for our medical and non-medical viewers. So if you remember from the former video when we're talking about running from the dog and sympathetic nervous system, we're going to take it in another way. So you were running from the dog, and then you fell down and you started bleeding, and then your mother came, you cried, the tears were wiped off, and the blood was wiped off because the bleeding stopped. So what happened between the bleeding stopping and you falling down? That's the coagulation cascade. So the coagulation cascade, it kind of comes from two different places and then comes in the middle and forms a common pathway from the intrinsic and the extrinsic. So if you hear in, you already know it's inside something, and extrinsic is outside somewhere. So what happens in the intrinsic pathway? It's triggered by collagen, and then if in the extrinsic pathway, extrinsic meaning in the endothelial tissues, which is like in the blood vessels. Like if there's an injury in the blood vessels, that's going to trigger the extrinsic pathway. So we have so many coagulation factors, and I'm just going to summarize it as thus. The extrinsic pathway is easier. In the extrinsic pathway, we have two basic coagulation factors. We have 7 and 3 in the extrinsic pathway, and then in the intrinsic pathway we have 12, 11, 9 and 8, and then all those guys join the party. They meet up in number 10's house. So number 10 is in the middle, and then when the coagulation factor 10 is activated, it then activates coagulation factor 1, coagulation factor 2, which is thrombin, which then activates coagulation factor 1, which is fibrin, and then fibrin then goes to the injury site and then covers it, and voila, you have your clots. So that's the basic understanding of the coagulation cascade. So if you have your colloquiums coming up soon, remember 7 and 3 extrinsic, 12, 11, 8 and 9 in the intrinsic. They meet up at number 10, and then they activate 2 and they activate 1. And then 3 is your tissue factor, very important, because that's how the extrinsic pathway is activated. So why are we talking about all these coagulation factors? Why are these things important? Why did we separate it into the intrinsic pathway and the extrinsic pathway? That leads us into diagnosis. So if we are looking at the woman with issue of blood, we'll definitely have to check her coagulation pathway, because if it has been chronic, that means it's probably something congenital, it's something genetic, it's something that has been with her for a very long time. It couldn't be aspirin that caused this lady's menorrhagia, because like aspirin wasn't invented then, and also aspirin would not cause a chronic condition if she just like started taking it. So we'll have to check her coagulation pathway, and we have blood tests for this. Of course, we'll have to check her hematocrit, which will obviously be reduced because she has anemia. And then if we're going for the coagulation factors, we will check her clotting time, bleeding time, and then to check for the intrinsic pathway, we have the active partial thromboplastin time, which will be increased in von Willebrand disease. And if she has a problem with her extrinsic pathway, there will be an increase in her prothrombin time. So these are all going to be checked in your biochemical test. We'll have to do general blood analysis and for coagulation too. Okay, so what other tests will also be looked at? We'll also have an endometrial biopsy, where the cells of the endometrium will be taken out like a biopsy and then looked at under the microscope. And then also we'll do a pap test, which is where we take the cells of the cervix and look at them under the microscope. Like I said, blood test, and obviously we'll do an ultrasound. And then after doing these tests, they can lead us to do further tests, which we have like the hysteroscopy. If we go hystero from Latin is the uterus, and scopy is scopy, where we're like looking at something inside. And we have the sonohysterography, which is sono, which is ultrasound, and hysterography, where we put like we look at, we have like an endo ultrasound, an endo inside ultrasound. So we put the device inside, when ultrasound is usually just like from from outside. So I think that basically covers it. Oh, and another a cause of menorrhagia could also be, like I said, hormones acting, hormone being imbalanced. So we definitely have to do check her hormones, check the levels of progesterone and estrogen, and also check levels of her thyroid, because thyroid problems with the thyroid gland could also lead to menorrhagia actually.
Okay.
So yeah.
All right, now we'll go to the treatment, and our treatment is going to be symptomatic. Yeah, based on, of course, Emmanuel started by speaking about anemia, he started speaking about psychological issues, and of course, depending on the different causes also, because he spoke about fibroids, spoke about cancer, he spoke about prolonged use of aspirin and all those things. So we could actually look at the particular problems or the things that are causing this particular menorrhagia. So if, for example, if you have, of course, if definitely the patient is going to show symptoms of anemia, which of course will treat anemia. And in case there are cramps, Emmanuel has already spoken against aspirin, yet it's an NSAID. Yeah, much as there are cramps, you'd actually look at other NSAIDs that do not promote or reduce the work of platelets that actually help in clot formation. And yes, and if, for example, if it's fibroids, how would we treat it?
So if it's fibroids, basically fibroids could actually have no symptoms at all. But if it's a severe case of fibroids, we'll have to go for a hysterectomy. Or we could go for endometrial ablation, which is basically like, in layman terms, it's basically taking some of the cells of the endometrium and just like killing them.
Okay, so we've looked at the different treatments, and Emmanuel has spoken about hysterectomy, which would actually deny this particular woman her rights of giving birth. Yeah, and of course, we have also other ways of treating. For example, giving the woman contraceptive pills. Yeah, because he spoke against
intrauterine device.
Yeah, so those devices could actually
cause menorrhagia. So you would have to give tablets in this case.
Yes, the pills.
Yeah, like if I'm not mistaken, progesterone pills could actually help, because if you remember, estrogen, a lot of estrogen and low progesterone causes the endometrial lining to grow more and more and more, which leads to heavy bleeding. So if we should increase the level of progesterone, that the reverse would
balance
be the case.
It out.
Yeah.
Yes. So guys, yes, that's it for the treatment. And just relate this particular portion of scripture to you and I. How do you relate to it? You personally, Emmanuel, how do you relate to it?
I think I love making Bible jokes, Christian jokes, and I always say that sometimes I have my woman with the issue of blood moment where with God, where I'm just like, God, I'm as long as I can just see your face, as long as I can just see you, when everything around you looks like it's going crazy, but as long as I see this, I know that you're working, because the woman with the issue of blood, there was everyone around her was telling her, sis, you can't go to Jesus, like, we don't need you right now. But she went through all that and she just said, if only I could touch the hem. Like, I don't care what these people are saying, but like, if I could just touch the hem of his garment, I would be healed. So there are those moments in my relationship with God where I'm just like, if only I could just see this, I believe that I will get my miracle. So it's just, it's that moment of crazy faith. It's that moment of it was a moment. Yeah,
for me personally, I see her, whenever I see the woman with the issue of blood, she actually suffered with it for 12 good years. And we personally, okay, a lot of us out there, we have issues that we are going through, and we just don't want to lay it out. We just don't want to touch the hem of Christ to just make sure that, okay, I'm getting done with this, or just lay it at the cross. Yeah, a lot of times you just want to hold on to them. But yeah, this woman just teaches me that, okay, you could have faith and just touch on God and touch on Christ, and all this would actually go away. And also the fact that Jesus healed her. I mean, the fact that just the hem of the garment, I think you're the one saying that even if it was actually just the face,
if she just saw, like, if I just saw Jesus.
Yeah, just seeing. I mean, it could actually be that if I can just go in that crowd, I would actually get healed.
Yeah, if I can just hear his voice.
Hear his voice or anything like that. So that kind of great faith is just something we could actually learn from.
Yeah.
And of course, we do not want to finish this video without giving the glory to Jesus, because wow, I mean, who heals such kind of people? And a lot of time, of course, even in modern day, we have women that are going through menorrhagia, and a lot of them could actually have their wombs removed. But this is something that Jesus just healed with just virtue that came out of him. And yeah, it's just amazing, and that this just teaches us that we could actually take all our issues to him, and he's definitely ready to answer and just give us the miracles that we're looking for.
I mean, think about it. After Jesus healed someone with just the hem of his garment, imagine, he still says, greater works than these shall we do.
Oh,
that's a lot.
Yeah,
that's a lot. Wow.
And yeah, okay guys, we want to continue and talk, but yeah, we've come to the end of the video. Please, if it blessed you, if you have questions, yeah, just write in the comment section so that we're encouraged. And by the way, Emmanuel here, as we said, he's a final year medical student. If you also have questions, personal questions in the medical field, you could actually ask him. And yes, if you want to, okay, yeah, he actually works in our admission office, for those ones here, because I usually talk about applications in this channel as well. So in case you have questions concerning application to any Russian university, particularly Pirogov, he would actually just help you to gain access to the university, because he has an upper hand to answer to that. And yeah guys, do you have any words for our viewers?
I think the first thing that comes to my mind is that science doesn't dispute the existence of God. It actually proves the existence of God. And I just want you to have that in mind. And if you are very, very sure that you want to be a medical student, then by all means, I am ready to receive any questions and to motivate you and to clean your tears when you start crying them. Oh my, I'm sorry.
Yeah, he has been doing that to us, to me personally, so yes, that's very true. And yes guys, thank you so much for watching this video. May God bless you abundantly, and see you in the next video that is coming up. Thank you. God bless you.
Thank you.